What stage of arthritis stem cells can be used and why stem cells cannot be used in advanced arthritis with deformity? The stem cells where they develop into cartilage and bone can be used in stage 1, stage 2 arthritis and some cases of stage 3 arthritis. Basically, in stage 1, stage 2 and some cases of stage 3 arthritis, the cartilage is damaged and stem cells can develop themselves into cartilage and replenish the cartilage. But in some cases of stage 3 and most of the cases of stage 4, there is advanced osteoarthritis, there is bone loss and there is deformity. In these cases, stem cells cannot work because of the deformity, there is point loading, and even if cartilage is regenerated, it will again get damaged. So stage 1 and stage 2 arthritis, definitely stem cells will help. Some cases of stage 3 arthritis can be treated with stem cell therapy, but stage 4 arthritis, there is complete contraindication for stem cell therapy. Thank you.